Hello, my name is Reinhard Kitzberger from the Department of Gastroenterology and Hepatology at the Medical University of Vienna. I would like to discuss our manuscript entitled Severity of Organ Failure is an independent predictor of intracranial hypertension in acute liver failure, which is published in Clinical Gastroenterology and Hepatology. Hepatic encephalopathy and its progression to cerebral edema and intracranial hypertension is still a leading cause of death. Ammonia is the most implicated toxin in hepatic encephalopathy. High levels of ammonia increases the risk of intracranial hypertension and is associated with later death by cerebral herniation in acute liver failure. Thus, ammonia is an important prognostic parameter for outcome and is helpful to predict which patients are likely to have intracranial hypertension. However, threshold levels of ammonia for developing intracranial hypertension and the correlation with the severity of hepatic encephalopathy is not consistent. One of the reasons for the inconsistent neurotoxicity of ammonia might be that in biologic samples, ammonia is usually assayed as total ammonia. However, only the unionized ammonia, expressed as the partial pressure of ammonia, freely diffuses through the blood-brain barrier. The partial pressure of ammonia can be calculated from total ammonia and pH value and increases with alkalosis. Another possible reason for the inconsistent neurotoxicity of ammonia might be that the neurologic complication in acute liver failure is a part of a systemic process. Recently, a study showed that the risk of intracranial hypertension is associated with circulatory and renal failure. Therefore, the aim of our study was to test two hypotheses. First, partial pressure of ammonia correlates better with clinical grade of hepatic encephalopathy than total ammonia. And second, progression of organ failure increases the risk of intracranial hypertension. 87 patients with acute liver failure admitted to our intensive care unit were included in the study. All patients developed hepatic encephalopathy within 4 weeks from onset of symptoms. After admission and every 24 hours, we diagnosed and graded hepatic encephalopathy. At the same time, we measured arterial ammonia levels and pH value for calculating partial pressure of ammonia. To quantify the severity of organ dysfunction, we used the Sequential Organ Failure Assessment Score, the SOFA score, which includes 6 organ systems. SOFA scores were assessed after admission and every 24 hours. In patients with clinical signs of intracranial hypertension, the diagnosis was confirmed by cranial CT scan and intracranial pressure monitoring. 42% of the patients developed intracranial hypertension during the course of acute liver failure. In univariate regression analysis comparing patients with intracranial hypertension and patients without intracranial hypertension, the highest levels of arterial ammonia, partial pressure of ammonia, and SOFA scores were independent predictors of intracranial hypertension. According to a cutoff level of a previous study, we defined 2 subgroups of patients with ammonia levels lower than 146 micromole per liter and greater than 146 micromole per liter. From the patients with ammonia levels lower than 146 micromole per liter, 25% developed intracranial hypertension. These patients had significantly higher SOFA scores compared to patients without intracranial hypertension, despite similar ammonia levels. Both total ammonia and partial pressure of ammonia correlated significantly with grade of hepatic encephalopathy. However, in multiple regression model, only the partial pressure of ammonia was an independent parameter on hepatic encephalopathy. In conclusion, this study demonstrates the important role of hepatic and extrahepatic organ failure as independent predictor of intracranial hypertension. SOFA score can be used to predict which patients are at risk for developing intracranial hypertension and is therefore helpful to identify a patient who should be admitted to the intensive care unit earlier. We confirm ammonia as the most important toxin in hepatic encephalopathy and intracranial hypertension in acute liver failure. Furthermore, the partial pressure of ammonia explains the main part of the neurotoxic effect, as it reflects brain exposure more closely than total ammonia alone. Thank you.